Good morning. My name is Dawn Holy. I'm the owner of OsteoStrong on 17th Street. We are a musculoskeletal strengthening center, and we help build people's bone density, muscle strength, improve balance, and help with joint pain. And today I'm really excited to be talking to my friend Hisham Abdel, who is the owner of Thera Cave in Fort Lauderdale,
Yeah.
physical therapy practice. And a few fun facts before we get started is that Hisham is originally from Egypt, but spent a lot of time in the United States when he was growing up. His father was a biologist, and so he learned, or he was actually the only one in his family to actually like biology. So hence that's
Yeah.
where he got the love of physical therapy. He loves pickleball, tennis, and ping pong. And so today we're going to talk a little bit about his practice, how he got started. So give us a little bit more background. I alluded to where you're from, but tell me a little bit more about where you're from and how you grew up.
Okay, so um, I was born in the United States. Spent most of my childhood in Egypt because my family moved back after my father finished his studies. So and I graduated from Cairo University with bachelor's degree in 2008 in physical therapy. Then when I moved to New York, I finished my master's degree in the State University of New York. Uh, I've been practicing since 2008. I actually practiced a little bit in Egypt with a German company that
Huh.
was basically responsible of, sorry about that, that's responsible like helping amputees to fit them with prosthetic technology. So my treatments was more like a gait training and helping patients actually to walk. So that was like, and I seen some, victims, from wars or just diabetic foot or, so I have this, and also I worked in professional soccer in Egypt. It's like a little bit of all over the place kind of thing. So, and then when I moved to United States, I worked in so many settings. I worked in hospitals, I worked in assisted living, I worked in rehab centers, like inpatient, outpatient. I worked in outpatient facilities with car accidents and workers' comp accidents. Then I came to a realization that all this time I haven't been using my skills. I invested in so many certificates, like the like joint mobilization techniques and certificates, and like taping and soft tissue work and cupping and needling. There is no time in regular setting to practice any of that. So, and I start seeing other people, other physical therapists are doing, that starting going on their own, and I was like, this is a perfect setup for me. Like I didn't come up with it. I've been flirting with the idea for like the longest time, 6, 7 years. I already had like a side practice in New York City, but it wasn't full practice. When I moved here to Florida, I was like, I need a room to practice, somewhere to just see people the way I want, not how, like insurance dictates. And,
So
and it
it
took off from
sounds
there.
like it's a very personalized, patient specific approach. It's not just the a standard, protocol. It's really digging into and figuring out what is going to best serve that
Exactly.
patient.
Well,
Yeah.
we graduate from school, you know, all hopes that we're gonna make a difference. Then when you get, when you see reality versus what you learn in school, it's totally unapplicable. Unless
Tell me that. What do you mean by, like, you sound like it was a little disillusioning when you got into
yeah,
daily practice. How so?
because you only have a limited amount of time you can see patients. Also, so let's say you want to use your insurance, so you want to, and this is the most affordable way for patients. So most of the people want to be seen through their insurance because they pay for it and it's not cheap. So when you go to a practice that they accept your insurance, what happens is that they have a contract between the office that you're seeing and the insurance dictating how much they're going to get paid and what's the cap of time that can be spent with a patient. So therefore, when you go there, you can't, like, let's say I'll talk about myself. I have some neck and back issues, and which is true. I still like do some treatment here and there. I do my exercises, but if I want to go see a therapist in an office with insurance, they're gonna need a referral and authorization to treat the back. And if I say in the same session, oh, but can you do some work or like help me with my neck, they can be nice to me and do it, but they don't have to. If they're busy, they don't have to do it. They need another authorization from the insurance for another body part, and then they can't do it in both body parts in the same session because there's not enough time. You only have maximum. If it's a really nice office, they will give you half an hour. So half an hour to treat neck and back, and then also help me understand what I need to do on my own. There's not enough time. And also, like, there's no injury that it's only like a separate island. Everything is connected. So when you have an injury, there's always an associated areas with it. So you never really get the treatment that you need. And that's how I see it from my side as a therapist. I never have the time to do the treatment that I need. And people have to come 20, 30, 50 times to get just a little bit of what we need to do, which is what I do right now. I spend 1 hour with the patient, or we can get into that if you want to ask.
Yeah, well, just a little bit to amplify your point about, I know that there's been a lot of situations where people think their pain is coming from one area, but when you really delve deeper into it, it's coming from a completely different area,
Yeah.
and I would think that there'd be some, you might be a little handcuffed if you were in the regular insurance system to kind of treat the whole, like you were saying, the whole system, and making sure that it's all working together
This is a
to
big
have
topic.
long-term success.
This is a big topic, and I hope like your audience will have like the patience to hear about this. But it's like once you learn something like this, you'll understand that you don't need to go like with the traditional prescribed way. And I'm not saying it's the traditional is bad, but I'm just saying that it doesn't fit every injury or every medical issue that you have, like the way the system is set up. So, for example, someone has stomach pain, right? I'm not going to talk about musculoskeletal. I'm going to take an example from just a medical issue. Someone has a stomach pain. You go to the doctor or ER, whatever. They found that they have appendicitis. They do a test. So first you go to the doctor, visit, test, procedure, medication, and then it's over. Okay, that fits that case. But like if you have a back pain, you want to do. That's what you go through the system. It's like, okay, you go to the doctor, they give you medication, which is basically masking the issue. It's just if they give you muscle relaxants, the problem is not that you're having overactive muscles. So you don't need a muscle relaxant to depress that. You basically need to treat that. And we'll get to that in a sec. And then they give you an anti-inflammatory, just a painkiller, so you can just be able to sleep at night, which I understand. If you need it, you should take it. If you can't function without it, maybe, but just for a short time. Then you do a test, MRI, oh, you have a lumbar disc herniation. Okay, now people come to me, it's like, can you treat the lumbar disc herniation? Can you put the disc back in place? So it's the same idea, like, okay, there's an appendicitis, can you just take it out? Or there's a gallbladder issue, treat that. That's not how it works when something is related to movement. It's a movement system, it's a mechanical issue. It has so many moving parts. And also the MRI or X-ray took the picture of you in static. So we didn't
Never thought about that.
Yeah, so we didn't assess your movement. Like, can you bend? Can you extend? What can we do to help that movement? Yes, do you have pain? Okay, what can we do to help the pain? What can we do to improve the strength? And then once your function improves, then you don't have to treat the diagnosis that you have. Your diagnosis is that you have impaired function, not disc herniation. So the disc herniation is what the MRI says. But what's your representation? The problem is that we need to treat your function. And the MRI shows that if we do there are researches done that if we pick a random group of people with or without symptoms and we take a look at all the MRIs, most of them will have disc herniation or bulge. Not necessarily all of them going to have sciatica. And
That's interesting.
I can dive into that and explain why that happens. That some people have symptoms and some people don't.
Well, I do want to, in another interview, because these are very complex issues.
Mm-hmm.
And one of the things I think that I also realize, as the older I get, is that a lot of times when you have pain, it's a result of something you've been doing for years, and it's not something that there's some magic fix always for, and it takes commitment, and, it takes really somebody willing to be a detective almost to figure out what the root cause is and what are the lifestyle changes that can be made to fix that. And it seems like that is the whole approach
Mm-hmm.
of your practice. That's how you're different
Yeah.
than regular a lot of other physical
It's
therapy
like the same idea like
offices.
losing weight. You can lose weight by go do a surgery, like one of these surgeries, or is it better to lose weight by doing exercise, dieting, being
Yeah,
healthy, right? So
yeah,
which one is
yeah.
better? Maybe one is facilitating the other, but it will never work. Like you will never be able to maintain low weight without improving the lifestyle. Maybe you can have
Right.
something as a like a catalyst to lose weight, which I'm okay with, but we'll never be able to retain it without the healthy lifestyle, which is the same thing that happens. Like
With
when
this.
I have this lady this morning, and she's like, "How long I'm gonna have to do these exercises?" And I told her, "You're gonna have to do them for life." And she's like, "Wait, so I can't be normal?" I'm like, "The normal is to do the exercises, right?
You're
Not to be
changing. You're
sedentary."
creating a new normal.
Yes, exactly.
Well, so what have you learned in your practice over the years?
um,
What's the most important thing that
oh,
stands out to you?
it's all up to you. So I can help you to a certain degree, but it's your intention and your readiness to change is what's going to bring out about the healthy spine and healthy joints and improve your core and posture and never look back. But it will come back if you don't have that readiness. If you want me to carry the weight for you, I can be a catalyst for the change, but I can't be all the change. I can only facilitate that. And if someone promises you something like this, then I don't think they're being too sincere to you.
Mm,
So that's how I found out. Like some people will be the most successful ones are the ones are committed to change, that they take responsibility and accountability of their health. And I'm like kind of like a like let's say like I'm their therapist. I'm like a coach to them. Like I see their progress and we work together. But
It's a team.
but
It's a team effort.
it's a
It's
team
not
effort.
just you fixing them.
Yes,
Yeah.
exactly.
So I know you do a lot of other interesting modalities like cupping and dry needling. And is that, do you see that in most physical therapy practices or?
It depends on the type of the practice. So most of these treatments not covered under insurance,
Mm,
or if they do, there's not enough time for it to set up, properly. Because
hmm
usually, so the dry needling is basically. Can I tell the, what's
hmm
dry needling? Because a lot of people don't know what it is. So dry
hmm
needling is basically the use of acupuncture needle in the musculoskeletal system to release pain and improve muscle tension, get some fascial release. Um, and it's the most effective way by far, from my experience and my patient's experience, to release pain in a shortest time and with the chronic issues.
Yeah.
Um,
Do- And
so the
then
dry
the
needling
cupping,
takes.
what does the cupping do?
So cupping is a it's it's an ancient medicine. Like it's been done for you know centuries. So, but cupping, what we see it in evidence-based practice. So again, I'm a physical therapist. I'm a medical practitioner. So we work on evidence-based. We don't. So if something has evidence that it works, then that's one. When we use it, we don't use anything that is not evidence-based. So cupping is a decompressive force. So the negative or the vacuum pressure that caused by the cup creates a stretch within the tissue, so it helps to improve mobility for a short time, and we improve the function, then you're able to move better. So all the treatment usually it gives you a window of opportunity to improve your function, your pain levels, your mobility, so that you can be able to do the home exercises I will prescribe, and also if you do like some restorative work like OsteoStrong or Pilates or like yoga, also you'll be able to do it better because now you have less stiffness and less pulling from other like tight tissue.
And so what do you see in the future? Any changes coming down the road with the physical therapy community?
Well, the changes already happened. So physical therapy used to be like an allied health medical profession. So we only work under the supervision of doctors, like historically. Now we are an autonomous profession. You can see a physical therapist without a referral. No need for authorization unless your insurance requires that, which is sometimes that's what they want, so they don't pay for it unless they approve it first. By law, you are allowed to see a physical therapist. Physical therapists will do their best to identify the issue, and every physical therapist is supposed to like refer you to the doctor if the issue is outside of their scope. So let's say I see someone and had like some type of infection, and I immediately tell them, okay, you gotta see the doctor, treat this. So we don't have answer for everything medically, but we are supposed to complete the circle. So if someone has an issue that requires a medical attention, then we refer him to the doctor. We don't need to see the doctor first to see us. So that's one of the changes, the positive changes. New graduates now are all doctors of physical therapy, and what does that mean? Is basically they have higher clinical skills upon graduation, so they can see patients right away. So the problem is the insurance system, and a lot of people are doing like they're not subscribing anymore to physical therapy, and that's the problem. So patients say like, yeah, I've been to physical therapy. You're gonna show me a couple exercises and just sit me on the recumbent bike and count from 1 to 10 while I'm doing the repetitions, and and that's how some people see it, and they have negative experience with it, and that happens in the traditional physical therapy practice that's run by insurance companies that dictates how we manage our time with the patient. So that is changing over time. However, not in the best way, because what happens is that you have big big companies are buying small physical therapy offices and they turn them all to a network. So you get like a McDonald's type of physical therapy that is cookie cutter, pre-packed treatments, revolving door, with a huge budget that they can market and everything. So that way, it's still kind of like something that it's working. Maybe maybe it's a blessing in disguise. Like because you still have like the therapists like me, and there are a lot of people I know that they do independent work and they do the right physical therapy that the patient needs, not what the insurance dictates.
So really,
So political, right?
as the field gets more, chains being, basically chains providing physical therapy, that it's going to be the individual physical therapy offices that are able to really provide that specialized, one-on-one tailored treatment that's going to be the most effective at getting somebody back to full, mobility and health.
Yeah, if you most of my reviews are this, like, oh, the attention, the personalized treatment, stuff like that,
Yeah.
and that's how it should be.
Yeah.
That's how it
Yeah.
should be. Like it's nothing. Like I don't like to think this is should be special. I think this should be the normal. Like that's how. Yeah.
Yeah, I agree. So how can people get in touch with you?
You can visit my website on theracave.com. You can fill the contact us form. If you want to talk to me directly, you can put what time is good for you, and I can call you and we can chat about your condition, and what are the issues that you have, and how can we help you, and find out if we can help you first of all, and yeah, and you can find me on social media. I'm on YouTube, on Facebook, on Instagram, TheraCave as well. Make sure that you put the V because they try to correct it into TheraCare, but it's TheraCave. It's like a cave,
Okay.
okay, and there's therapy happening inside of it. So,
Oh, okay. I'll put the information in the post too.
yes,
So thank you very much,
yeah,
and
thank you.
look forward to
Thank you
more
for having me.
treatments.
Yes, thank you so much.
Bye bye.
Bye.